forget. And okay. So welcome everyone. I'm just going to do let you know that I am going to be live streaming to Facebook for a little bit for the presentation part. We will turn that off. We are recording, but the recording will only be shared with those who have registered. The recording will have everything, including our questions at the end. So before I do our official start, let me just get the Facebook part up and running. Thank you for joining us tonight. And I apologize, this part always takes a minute.
I think most people are used to the tech stuff by this point, so
Yes, yeah.
you take your time.
Okay, looks like we're good to go. So good evening and welcome everyone. Again, I'm Erica Narducci. I'm the program director at Cancer Support Community Delaware. It is my pleasure to be partnering with medical oncology and hematology consultants and Delaware Breast Center and the doctors here tonight that you're going to be hearing from. So just very briefly about us and what we do. We provide no cost support to all cancer patients in the form of support groups, healthy lifestyle classes, and education sessions like this one tonight. So without, and as I mentioned, we are recording, so you'll have this for later in case you hear something and you want to go back and listen to it again. And so it is my pleasure now to introduce and bring up to the spotlight Dr. Frost. Hold on, I'm going to add her to our spotlight, and also Dr. Vera. Here we are, and very soon we will also have Dr. Quarterman, and as soon as she is here, I will add her as well. So ladies, I will turn it over to you.
Thanks, Erica. So it's so good to be here with you all. And this is going to be like very conversational. We very much welcome, if you want to put questions in the chat, kind of as we're talking about different topics as they relate to that survivorship period. Feel free to put the questions in the chat. We will set aside like dedicated time at the end for any questions that you all might have. So you're welcome to wait and ask questions at that point. You're also welcome to kind of unmute yourself if there's something really pressing and we're talking about a specific topic. You can also just kind of unmute yourself and feel free to interrupt us and ask questions at that point too. So my name is Dr. Frost. I'm a psychologist. I specialize in clinical health psychology. I work at Medical Oncology Hematology Consultants. And really kind of my role is to provide support to folks that have been diagnosed with cancer and have gone through treatment. And that can be all the way from when they're first diagnosed, even throughout survivorship. So I'm excited to kind of talk about from my lens, the things that I most often work with folks around, the challenges that I see and kind of how I help folks. And I'll let Dr. Vera introduce herself.
Hi, everyone. I'm Ramya Varadarajan. I'm one of the medical oncologists. I've been in practice in this community for about 15 years. I recently joined Medical Oncology and Hematology Consultants, and I work with Dr. Frost. I do mostly do breast cancer in the community. Some of them might know me because I've been around, and I like to deal with survivorship issues with my patients because the journey is not done after the treatment is done. So I am happy to be here, part of this meeting, and answer questions and concerns from you all.
Thanks, Dr. Vera. So before we kind of start into some of the topics that we have started, we kind of brainstormed beforehand, I would love to introduce Tracy Travis Lee. She is a breast cancer survivor, 2007, and she's going to share a poem that she wrote in about 2008, so shortly after her diagnosis. Tracy, I'll turn it over to you.
Okay. This poem is called The Impact, and like Dr. Frost said, I wrote it after I went through the hardest part of the cancer, and I was getting ready to go through reconstruction, but somewhere along there, this just came out of me. Um, how can you describe the feelings deep inside that stir within your soul? To the deepest dark reaches, this illness does teach us that you don't need two breasts to be whole. An about face in life is caused by this strife. The fear is nothing you've known. At my Lord's feet I laid my burden and prayed that it wasn't my time to go home. There's too much to do. My life can't be through. My children need me alive. I'll do what I must. The hell with my bust. I'll fight the good fight to survive. And the sickness and pain in his lap my head lain. My comfort was found in thee. My doctors he picked, and this cancer we licked. Thank you, Jesus. I'm now cancer free.
Thank you, Tracy. And I think Dr. Quarterman logged on. Erica, I don't know if you would mind spotlighting her as well.
And with all of us together, how many?
Fabulous. Hi, Dr. Quarterman.
Hi. Still trying to set things up here.
That's okay. Take your time. While you do that, I would just ask for the folks who are participating, it would be super helpful. Just remember to mute yourself. That way, sometimes there's all the kinds of ambient noises that can come into it. So just to make sure that everybody can hear clearly, and that can help. So while Dr. Quarterman's getting set up, just kind of catching you up to speed. So right now, Dr. Vera and I just kind of introduced ourselves and who we are and what we do. And Tracy shared her poem. So Dr. Quarterman, I don't know if you want, when you're ready, feel free to kind of introduce yourself and your role in our practice and in your practice, and then we can get started.
Sure. Yeah, I did hear the poem. That was beautiful. Thank you for that. That was great. So I'm Renee Quarterman. I'm a breast surgeon, and I started out owning Delaware Breast Care, which is a breast surgery care practice that opened in 2019. And it's been a year now that my practice merged with medical oncology hematology consultants. So we've been able to expand what both groups offer. And so it's great to be part of the team with Dr. Vera and Dr. Frost and a lot of other providers, still providing breast cancer care and any other concerns related to breast health. And yeah, that's what I do.
Fabulous. So I think we can go ahead and kind of get things kicked off. Renee, I'll turn it over to you. So Dr. Quarterman's going to moderate for us. So the spotlight is yours.
Okay. So as you all know, and thank you very much for coming and spending your evening with us, trying to really talk about with this event tonight, issues around what happens after treatment for breast cancer. Because a lot of women, once they're disease-free, they still have a lot of health concerns, mental concerns, spiritual concerns that maybe don't get addressed as avidly as the disease itself. So hopefully this can be a great opportunity for you to get a lot of your questions answered, maybe air out some of the worries that you don't feel comfortable talking about when you follow up with your doctors. So Dr. Frost and Dr. Vera have put together some great information. I mean, they're experts already, but they've organized everything for you all. So my first question is around menopause, because a lot of women after breast cancer treatment, either because they were going through it already or because their treatments call for it, have issues with menopause. And it's a really big issue that they deal with every day. So do you two have any thoughts about it? Any treatments, any ways to help women deal with it?
I can go first in this.
Mhm.
So menopause symptoms are quite broad, and we just encompass everything and put together in one box, but it can be as some people can just have hot flashes, some people can have vaginal dryness, some people can have insomnia, and some people can have a combination of all these things, mood changes, brain fog. So a lot of changes. And when sometimes we treat breast cancer with medications that causes menopausal symptoms, and that's one of the main things that I deal with when patients come to me for follow-up. So first of all, we have to find out what are the main complaints, and then how severe are they? Are they affecting their quality of life? Is it minor? Do they need any dose changes? Do they need to change the time when they're taking the medication? So we do a detailed history about it. And then I recommend medications and supplements based on their main complaint. So if we can talk about the big thing, the hot flash. And it can, when people talk about hot flash, it can be mild that they just carry a fan around, or it could be as severe as they are not able to sleep at night and they have insomnia, and that can cause a lot of downstream issues. So I commonly talk about over the counter supplements such as vitamin E, and there are non-estrogen based medications that are also supplements that are effective in hot flashes. We talk about good sleep hygiene if it is insomnia. Vaginal dryness is another major thing that we talk about, what they can do. We talk about emollients and lubricants that are not estrogen based, and having a visit with the GYN to see how bad it is. We talk about decreased libido, and Dr. Frost will tell about certain things that she has certain, we have local therapists that helps with decreased sexual drive and libido. So it's a wide variety of things that we address. So if they have a specific symptom, then we can go in detail to that and then address how we can treat that issue. And sometimes I hold the medication and then I ask them to come back and see if it's the medication that's doing it. It could be something else. So it ranges a lot, but that's one of the common things our patients deal with. And we are very cognizant of that. And mainly, I also feel like sexual health, that we should, most providers, not providers, the patients are sometimes not comfortable bringing it up. One of the studies showed that less than quarter of them talk about it with their providers. So I think it's, as a provider, it's our responsibility to bring it up when I am giving a medication that can cause those symptoms. So I encourage them to talk about it and be open about it and address those issues. Dr. Frost.
Yeah, I think this is one of those things that so many women come into my office and they're like, I feel like I'm going crazy. I don't know what's happening. My mood is all over the place. And usually the hot flashes are like the biggest outward symptom that they're struggling with. It is, I think, a really challenging symptom and side effect that so many women don't necessarily anticipate experiencing, right? You go through treatment and you have all of these other things happen, and now you're having kind of these ongoing symptoms. So usually a lot of it is validating, like, yeah, this does kind of suck as part of the treatment. It's not fun, especially if you are somebody who was on the younger end and menopause was not something that you were already experiencing. Particularly for things like hot flashes, we are really trying to figure out how can we kind of reduce a lot of the triggers for the hot flashes. So that includes things like managing stress. That includes things like even starting to modify or perhaps even adjust how we're even thinking about things like hot flashes and menopause. Like sometimes that causes us to have an emotional reaction, and sometimes emotional reactions can trigger those hot flashes. So a lot of it is really working with how do we manage this in a way that doesn't really negatively impact our quality of life. For the insomnia that often comes with menopause, and a lot of folks let me know, like, hey, I'm waking up with night sweats and I'm soaked and I'm uncomfortable. Some of it is kind of general sleep hygiene, but a lot of it is, again, that relaxation strategies, helping you breathe through when a hot flash does occur, and reducing kind of the emotional reactions that we have when those symptoms come up. A lot of folks find that they start to avoid certain places, doing certain things because they might feel embarrassed when a hot flash comes on. And so it's, again, kind of managing how do we navigate that? The sexual health piece, just like Dr. Vera said, I think is something that I more often hear in my office, because a lot of times folks don't feel necessarily comfortable talking about this at times. But it's something that I often bring up and I welcome and I encourage, I ask about and I check for, because it can be something simple or not simple. It can be something like vaginal dryness, but it can also be something deeper, like changes in what we think about intimacy and what intimacy looks like. It can be kind of how's this impacting our relationship with ourselves or with our partners. So some of it is talking through how do we improve communication with your partner? How do we help with relaxation so that any form of intimacy can feel more comfortable, can feel safe? And how can we also then get you connected to other resources that can help if there's any kind of anatomical support that we can provide, things like pelvic floor therapy, physical therapies, therapists that specialize in sex therapy. So we do have a lot of resources at our disposal. I know it's a taboo topic. It can feel uncomfortable to talk about, but for us as women, it is such a part of quality of life and life in general. So making sure that we're attending to all pieces and aspects of ourselves is really useful in making sure that we are navigating that survivorship period as best as we can.
Also, there are prescription medications for hot flashes, and I don't want to go into details, but like there are things that we can help with if over-the-counter medication do not help, and to bring it up to the provider and say, hey, I tried this, it's not working. Is there anything prescription medication you can give? So there are reasonable options for hot flashes.
So, Dr. Vera, you talked about maybe holding one of the medications and then seeing if that medication is the cause of symptoms. Is there any benefit to trying to change the medication or holding it for a long period of time? And I've had some patients ask about, can I cut my pill in half or can I take it less frequently? How would you address those questions?
So unfortunately, with regards to hot flashes, I have not seen a benefit if they cut their pill in half versus take the full dose. I feel the hot flashes are similar. Maybe the other side effects like joint pain is less when they cut the dose. I do try to change from one medication to the other. I was telling earlier that I ask patients when is the worst time that they're getting the hot flashes and when are they taking the medication. And if they say they take it just before they go to bed and they wake up at 2 a.m. and 4 a.m., I ask them to switch it in the morning and they notice that yes, there are hot flashes, but they're able to sleep through the night. We talk about like cooling blankets and cooling, there are cooling pillows that you can get online. That has helped a lot of patients. So we try a lot of non-medication techniques as well. So to answer your question, I do not recommend cutting the dose in half for the specific hot flash issue. And yes, we can try switching one medication to the other. Not all, it doesn't always work, but about 30% of the time it does work.
Well, that's a higher number than I thought, so that's encouraging. So another issue that a lot of women notice is that their bodies change after they've had their breast cancer treatment or in their on their endocrine therapy, their anti-estrogen therapy. A lot of women come to me with concerns about weight gain and not being able to get the weight off. So what body changes or physical changes do you all notice do patients describe to you, and how do you advise them about what they can do about them?
I think it's a big issue with our patient population, right? Like I give them chemotherapy, they lose their hair. They sometimes have mastectomy where they remove the breast, or sometimes a lumpectomy where one breast is smaller than the other. They have pain from the surgery sometimes, so they are not able to. And then with the endocrine therapy, they have vaginal dryness. So it's a combination of things that hits them all at the same time, or one worse than the other. So it's a big topic that we talk about. Um, I think Dr. Frost would be like, I do refer to people when they have when they struggle with these issues. But let's say like hair growth, like we talk about hair growth serums and stuff. With breast images, like reconstruction, like it has changed a whole lot. It has come a long way, and a lot of patients are happy with breast reconstruction. And if they think if that's one thing that they're putting off because it's another surgery, and they can weigh the options and see what matters to them. Mainly, I think there's the acceptance of the new normal, and sometimes it's hard, and that's where I think Dr. Frost comes in. What do you think, Anna?
Yeah, I think the acceptance piece is really hard, and I often let folks know that acceptance also often fluctuates. So there may be days or moments or times where acceptance feels a little more easily grasped, and there may be times where it's not. And kind of how do we ride that wave when those fluctuations happen? Um, I think so often, I also think kind of culturally and societally, right? For women in particularly our society, things like hair, our bodies, our breasts are signifiers of things like womanhood. And so when those things kind of drastically change in such a short period of time, I think it's also a very difficult challenge for women to navigate who I am and what is womanhood to me, when sometimes we've had a lot of experience with those being part of our definition and our identities. So it's also navigating what is that identity that we hold? How have those things remained consistent despite these changes? And how have those things perhaps changed because of these physical changes? I think another thing we often talk about is the fact that when you have these physical reminders of cancer, and they're there, right? You can't avoid them. You constantly are being reminded of the fact that you went through this experience, and that in of itself can be, I think, a significant challenge. So really, it's working with folks around how do we process this experience? How do we cope with these changes? How do we think about ourselves now that we've gone through treatment? And how do we, reach a level of acceptance and ride those waves when that acceptance changes?
May I say something?
Yes.
As a survivor, I just wanted to address a couple things. The menopause. I was 44 when I was diagnosed, and I went through chemo before they did anything. They said we have to do chemo before we do any operating. So I went through chemo, and I did lose my hair. My husband had to shave all my hair off, so that was a big adjustment. But it was better than having the clumps falling out of my head. I had the clumps falling out, and then I said, "Get it off me." So that was an adjustment and a realization I had to come to. Got it shaved off and moved on to the next thing. But the chemo put me into chemically induced menopause. So I was going through the whole cancer thing, but then I was in full blown menopause caused by the chemo. Dr. Himmelstein was my doctor, and he said, "You're chemically induced, you have chemically induced menopause." So I went through the whole thing. I went through the hot flashes, the mood swings, everything that you've mentioned. And that did last a couple years. And you know the whole thing. You're tearing clothes off, you're putting them back on, you're up, you're down, but going through cancer and going through that. So I kind of went through it hard and fast, and the whole journey was a couple years, but got through the menopause. But then you had mentioned gaining weight. Well, I gained a tremendous amount of weight after all the chemo, all the surgery. I had chemo, a lumpectomy. They had to go back, do the mastectomy. Then I had the radiation, and then I had the reconstruction. And I gained all this weight. I mean, I was heavy. And that was 2007, 2008. And through the years, just the common sense, age old, how do you take the weight off? Cutting out the junk, doing a little bit of exercise or upping your activity a little bit and eating healthy. And now I'm back down to 117. I was 175. So it took me years to finally get on board with that. But everything that all of you doctors just talked about, I went through all of that, but it was chemically induced menopause. And then I was on the Arimidex for 5 years. And I don't know what that was doing to me. I did take flaxseed every day. And then I was told, no, don't do that because it has estrogen in it. And I did get relief from that. But then as soon as I was told I couldn't do that, I stopped and I just kind of toughed it out. But, you go through these emotional adjustments too, and you're living it, you're going through it, and um, you just deal with it, And the bottom line is, like I think it was Erica said, we're alive. And right now, with all my reconstruction, and consequently, I just had another surgery in February because my reconstruction on the one side just kind of, the tissue just got weak and fell. And I had to have it tucked back up on my, not the cancer side, the side that they had reduced several times. That tissue just got so weak it fell and kind of went into my abdomen, and they had to redo it, tuck it up, and stitch it really tight. So I just had another surgery in February, and it's 2025. But I always say, and like Dr. Frost said, every time you look at yourself, you're reminded. And I look at myself and I think, I'm alive. And I say to my husband, I look like the bride of Frankenstein. And he says, I'm Frankenstein. So we're a good match. And I'm alive. It all works. And I'm just happy to be here. So,
Yeah.
such is life. So I just wanted to share, and thank you for listening.
Thank you. No, weight gain is one of the issues that we address a lot in our patients. So we talk about the same thing. Tracy's talked about what worked before menopause is different. What you could eat before, you can say I'm eating the same amount and I'm still gaining weight. Yes. So your metabolism slows down. So really working down and watching what you're eating, having a food diary, increasing your protein intake, and even with exercise, there are studies to show that more intense exercises for short periods of time rather than gentle walking is helpful for weight loss specifically. We talk about different techniques that works for different people. One technique will not work for everyone. So for someone, intermittent fasting might be work, and for someone, keto diet, like whatever works, like having accountability and going for it. And that's the hardest challenge of all the side effects. We talked about weight gain is one of the common things that we talk about.
Yeah, that's a real big one that's difficult for a lot of women to overcome, or kind of like Anna was saying, kind of settling into what the new normal is and just appreciating that the body is different. But like Tracy said, you're still alive, you're still here, and there's a difference, but it's okay. So Dr. Vera, you were saying that weight gain is something that you commonly see or you hear about. So I'm wondering for both of you, what are the most common concerns that your patients talk to you about? Other things?
Do you want, so when I give chemotherapy, a lot of my patients talk about brain fog. It's something that I'm very sensitive to. Like young patients who are moms and like who are being multitasking, running around with kids, and even like patients who are like just can whip out like 5 different meetings. They can not remember why they walked into a room, and that's something that we commonly see in even in menopause. We see it, but with chemotherapy, we rapidly, I think, shutting down the ovaries may cause that. So when you initially they were just like ignoring this symptom and they were thinking that patients were not like it's not real, but they actually do brain scans, functional it's called functional MRI and brain scans on people who are going through chemotherapy, and you do see the areas that are involved in high level planning and thinking is affected. And I do tell them, so for that I tell them it will get better, and do common things like write down everything. Try not to, I know it's hard as a multitasker, but it is going to be hard to multitask and just focus on one thing at a time. Exercise has shown to release good chemicals that fight the brain fog. So trying to do something brisk, walking for 10 minutes every day, when they can. So those are the things that we talk about, and it does get better after, it takes a while after the chemo is done, but I do see most of them get back to their baseline by a year. It is a long time after I stop the chemo, but they do get back to the baseline. It takes sometimes 6 months to a year.
Yeah, I would agree. I think,
And
oh,
I
sorry, go
just-
ahead, Dr.
Sorry.
Flynn.
Asking about that too. How about things like word puzzles, crossword puzzles, reading books? Does that help or shorten the amount of time that women will experience brain fog?
There have not been like studies to show that help. It has helped in dementia patients, right? Like, so people who have like early onset dementia, like doing those things have shown that it keeps them sharper longer. But many of my patients say that they were able to read chapters, but now they can't even focus on a page. So they only have short attention span. So I think, yes, if you can do that, I don't know if there is research to show that it helps with brain fog from chemotherapy. One thing that has shown is exercise or brisk walking. What were you going to say, Anna?
I think I was going to add to what you had mentioned. The brain fog or chemo brain, a lot of people mention that it is a very common challenge that folks navigate. And I think it's often multifactorial, right? So meaning it, chemotherapy can play a role, the general stress of going through something like cancer and treatment can play a role. There's so many factors that can really contribute to it. So even when we're thinking about brain fog or we're thinking about menopause symptoms or fatigue, for example, I really encourage folks to think about how can I come at this challenge in a lot of different ways. So, right, for brain fog, we want to do the exercising and stimulate our brains, but also making some minor adjustments and changing some things in the way that we do things can also help reduce the mental load or kind of how much pressure we're putting on our brain to remember everything and do everything. So sticky notes are a lovely, lovely thing. Folks who never had to use a calendar before or write down things, get a calendar, figure out how to write notes in your phone, adding reminders in your phone so that your brain is not responsible for hoarding all of that information. It takes the pressure off of your brain. The other thing is sometimes even adjusting, if it's possible, right, when you're doing things during the day. So if you know that typically in the morning you wake up and you're feeling pretty sharp, maybe trying to set your day up so that you're doing some of the more challenging tasks at that time. So by the end of the day, when your brain is more tired, you're not required to do more of the high level thinking. So sometimes it's just some behavioral modifications to help manage until the brain fog starts to clear and lift.
One of the other main things that our patients worry about is the fear of recurrence. And that's a big thing that we address in our survivors. I'm going to ask you to lead this conversation on Anna.
Yeah, I would say like probably 90% of the folks that I see, this is like a primary concern, if not something that we discuss at some point. And I think, even outside of breast cancer, fear of recurrence is something that almost everybody who goes through cancer, it is there to some extent. And it's fluctuating also. So folks may find that they're okay for a period of time, but perhaps when they start to have to go for a scan, or they have to come in for a doctor's visit or go get blood work, or, if they're still getting mammograms or whatever, sometimes they can notice that that suddenly increases. And it can kind of creep up on people. But it's a very common thing. So essentially, fear of recurrence is the anxiety around the fact that there is some uncertainty, right? We don't have a crystal ball. We can't say for certain that cancer will never come back. And that is a really hard thing to navigate. In general, our brains don't like uncertainty. Humans like to know. We are planful creatures. So when there is a question mark on anything in life, that can be really unsettling. So when you have an experience like cancer and now we don't know what the future holds, that can be really hard. So typically we kind of tackle this through reaching a level of acceptance that that uncertainty is going to be there. It doesn't mean we have to like it, but it means we recognize that this is part of our life now. Some of it is also making sure that we have accurate information so that we know, all right, what is our risk level? Even though there's aspects of this that are outside of my control, what is within my control to make sure I'm maintaining my health, following up with my doctor's visits, doing what I need to do to keep myself healthy, right? That is something that's in my control, right? I can have some certainty around that. And so we're kind of adjusting thinking, making sure we have accurate information, but also helping manage the fact that there is some anxiety, and that's understandable and that's real. And a lot of women do experience that. I don't know, Dr. Vera, if you want to add to that, kind of what you hear in your office or what women kind of bring up, or even Dr. Quarterman, what you've heard women talk about.
I usually find October month is a hard month for some of them because some of them love October month for our breast cancer survivors. Some of them just want to hide the whole month of October because they don't want to see any more pink. And I just tell them, do what suits you. Like if you want to be out there and helping other people, you can do that. And if you don't want to, you just shut down social media so it's not in your face. And like you said, I think I really like, because we like to have control and having what is in control, what is in front of us that I can control and focusing on that. We talk about scans a lot, like we don't do routine scans in breast cancer patients and they're like, oh, my friend got lung cancer and they get scans every 3 months. I want scans, and explaining to them how it does not help catch anything earlier in breast cancer, and studies have shown that routine scans do not help you live longer, and focusing more on your diet and alcohol intake, and those things help in changing your risk, breast cancer risk. What advice do you give, Renee, to your survivors?
So I try to address for each one if they have a particular fear. For some women, it's pain with the mammogram. For some women, it's anxiety with coming to the office or driving by the place where the mammograms are done. So really trying to pinpoint what is exactly causing that feeling of anxiety, and then trying to do some type of exercise to deal with it and face it and move through it. So it might be take deep breaths, it might be go a different way, it might be ask for a little anti-anxiety medicine before you get your mammograms, but really not trying to tackle it all at once, but looking at each thing that's causing the discomfort or causing the anxiety. And it seems like for a lot of women, if you can just break it down into smaller pieces, they're easier to deal with, or you might realize, oh, that's actually not a big deal. Oh, I can actually deal with that for a day or an hour. And then, quite frankly, a lot of times we'll have a conversation with Anna, what you were saying, that there's a lot of uncertainty. And none of us knows if, you know, cancer is going to come back, if we're going to develop cancer, and there's just a lot of uncertainty in life. And trying to just understand that even though a woman has had to deal with breast cancer, that everybody has uncertainty. And for some women, that makes it easier.
Yeah, I also think normalizing it because they are not alone, right? Like everyone who has gone through breast cancer, and I've seen patients who are so stoic during the whole chemo surgery part, and they're like, "What do I do next, doc?" And as soon as I'm done, they fall apart. And telling them this is very normal, like they're like, "Why am I now like so anxious? Because I'm done with my treatment." And letting them know this is very normal, and everyone who goes through this, we are in that flight or fight mode at that time, and then things sink in, and accepting that it's normal helps, I think.
I think the only thing I would add is that for some women, that fear of recurrence can get so intense that it starts to really impact things, right? So now we're not sleeping because it's something that our mind is just constantly kind of thinking about and going through. For some women, they start to avoid the doctor. For some women, they start to really over rely on the doctor because that provides reassurance and comfort, understandably. And so I think, while there is absolutely a very normal and understandable level of fear of recurrence and that anxiety, if you start to notice that it's really impacting you, that is a great time to reach out to your provider and say, hey, this is what's going on. How can we kind of tackle this, right? Because again, if that's getting in the way of quality of life and it's something that we can help reduce in the intensity and frequency, I think that is a worthwhile venture to explore and address.
So I didn't know if either of you had any other thoughts that you wanted to share before we open things up for questions.
I think we addressed the most important ones, and if our patients or survivors have more questions, yeah, I'm happy to answer them.
Okay. So if you want to put something in the chat, if you don't feel like speaking, I can say your question. I can read your question out. Or if anybody just wants to kind of start talking, I'll try to adjust my screen so I can see if anybody's raised their hand. Erica, do you have any idea how you might want to kind of run it, or does that sound good?
Yeah, I am watching the chat if anything comes in, and same thing for hands. So
Okay.
yeah, feel free to unmute yourself and just start talking, as mentioned.
While we are waiting for questions, if there are no questions, I was thinking, Renee, you had talked about like survivorship guilt. Do you want to talk about it a little bit?
Sure. So a lot of women will say, well, my cancer was small, or my cancer was node negative, or my cancer is treated and my doctor says that there's no evidence of disease. And they feel like the journey wasn't that hard after all, or the worry that they had is so far behind them that they don't remember it. So they feel guilty that they don't remember the pain that they went through. And it can really affect how they see themselves and how they interact with other people. So yeah, how do you all deal with that when people come to you and seem to kind of underestimate what they went through or feel like they had it pretty easy?
The mine wasn't that bad syndrome. I think that's what it wasn't that bad. People have it way worse. Yeah. I um I always point it out because I think what happens is when we get into that frame of mind, we kind of sell ourselves short in accessing resources that we absolutely deserve to access. Um, so if we are convinced that it really wasn't that bad, and there's people who have it way worse, they deserve to get support. They deserve to attend those events or meetings or have a mentor or connect with other people. We're not making sure our own cup is full, right? So if you were diagnosed and went through treatment to any extent, that is a life-changing event. And if you didn't have symptoms as badly as somebody else, what a blessing. And that doesn't mean that it still wasn't a challenge. Nobody's getting awards for going through cancer the best. So I think it's really important to remember that sorry if you can hear the baby in the background, but I think being really kind and gentle with ourselves and recognizing that, right, everybody has gone through this. And I think at least in my experience, the breast cancer community is so warm and welcoming. And right, we're not there to compare, right? We're there to support. And so hopefully if those feelings do come up, we can kind of catch ourselves and stop ourselves and remind ourselves that your experience is valid. Your experience is still very important, and it's okay that it was different than somebody else's.
We have a question in the chat, but I saw Gail, you unmuted yourself. Did you want to ask your question?
Eventually I've had the experience of having to help people that I know understand I have cancer and I'm going through it. When they can't hardly, what's the word? This is where I have brain farts sometimes. I have to help them understand that it's real, that I really have it, and like help calm them. So I don't know if anybody's had that help with a friend or what. I know that we helped one of my friends with brain cancer and passed away. That might have been a lot of that, but really helping them understand that I'm going to be okay and talk them through things because they don't know a lot. Not saying I do either, but I didn't know if anybody else that had that experience of emotionally helping them going through it while you're going through it. Because it's hard. They don't know. Anyway, I just was curious if
Well, I
anybody.
think you bring up a good point, and I will say that a lot of my patients will come in wondering, okay, I have this new diagnosis. You tell me all of these treatments. How am I going to deal with my husband? What do I tell my mother? I can't say anything to my kids yet because they'll be really upset. And I try to bring to each patient's attention that your job is not to take care of them.
Right.
And first of all, make sure you know what the plan is for yourself and make sure you understand it so that if people are asking you questions, you're not worried because you don't have the answers. Their questions and concerns don't have to be your questions and concerns. And then also, if you can find one person that can be, I call it like your bodyguard, your spirit guard, who can answer the phone, who can answer the door, who can check your social media for you so that they can ask you, do you feel like dealing with this today? Do you really want to have this phone call? Do you really want to go out with those friends? That's a way to have a buffer so that you can give yourself some time if you don't want to treat or help other people deal with what you're going through.
Yeah, I sort of waited. I had, what I did was get my base first of who would help me. And then once I understood things, and then I would reach out to a close friend occasionally, and she just happened to be one I knew. It's funny, you have the compassion. I had the compassion at this time. I felt like a doctor. I was very patient and caring. I could just feel that it was time to help her through and understand. Probably because we lost a friend together. And at the end, we were there at the end and everything. So there is that, yes, but there's so many different variables because each of our lives are different that there's no one way.
And I agree, Gail. Sometimes when we're the patient, we have to hold other people's hands too, and that can be a
Mhm.
challenging position. So I
But
think you're
I
not
had to
alone in that.
yeah, I had to get myself under control first though, and understanding. And then
Yeah.
you're able to help out. And you have to decide when to do it and cut it off. Nope, I can't talk today, like you said. No, I can't try to pay my bills today. No, I can't. I'm single. So I have my mom, she's 88 with me. So, just everybody's life's different, so like you said, there's no book, but there is help like here. There's some other, there's 6:30, there's a class I have to jump off, so I might leave y'all and, well, y'all, you can tell where I'm from. Anyway, but thank you guys for everything.
Thank you.
Good. Thanks for that, Gail. So this was a question in the chat. I've been on anastrozole for 6 months, developed joint pain in my back and ankles 2 months ago. It isn't severe, but it's enough to slow me down. I have more difficulty exercising because I never know when my back may spasm. So, any kind of suggestions about that, or maybe how to approach for how she should approach her doctor with these concerns?
Yeah, when people complain of joint pain, we have to first ask when it started. So typically when you start anastrozole or any of those sister medications, the side effects are noticeable within a few weeks. So if someone starts it and develops new pain like a year later or 6 months later, I always question it, is it due to it? So we do multiple things to find out if it's the medication. Sometimes I stop it for 2 weeks and see if it is. And the second thing is how severe it is. Is it like most of the symptoms with the anastrozole is you feel the stiffness when you start walking, getting up. But then once you start moving, it gets better. So there are multiple studies that have shown that people who exercise regularly or do stretching exercises like Tai Chi or yoga, they have less pain at the end of the day compared to people who do not. It doesn't make any sense, right? Like when you're in pain, you don't want to exercise. But if you do exercise, it does get better if it is due to that medication. If it is from arthritis, and other things, it will not get better. So that's how I know it's the medication. So in this person's case, I would, if it's spasming and stuff, I would make sure that there are no back issues. So talking to primary care or your provider to see if she needs any imaging of the back, and going from there would be one of the choices.
From a behavioral standpoint, I also like to check in, what are the exercises that we're doing and how long are we doing them and when are we doing them? Because I think once you're, past treatment, some people get very excited about jumping back into their old routine. And sometimes that can result in injury and or our bodies just might not be ready for that yet. So sometimes it's also an adjustment of what are the exercises that we're doing and how can we modify length of time or what those exercises look like so that we're not causing pain or causing back spasms or causing additional issues. So sometimes it's just helping people kind of rein it in and not overdo it.
Start slow and increase it gradually is ideal.
Yeah, and this is totally a plug for cancer support community, but particularly their yoga classes. I've had so many folks that I've worked with that speak so highly of it. And it's, I think, such a lovely, gentle exercise that can help folks start to get back into being physically active in a way that's safe. And you're with folks that are working with folks that have gone through cancer. So I think they're more cognizant. They understand and they're going to make sure that you're protected and you're doing it in a safe way.
Yeah. And I'll add, we have a walking group on Friday too. So I heard walking was mentioned as good exercise. So a little plug for that too. And the person with the question in the chat said thank you and going to discuss with her oncologist. So good. All right. Any other questions for your panel?
I think Tracy is raising her hand.
Yeah, just two things. You were talking about some people getting cancer and having it easier, and some people having it and it's more, they have to go through more. I think one thing is going through cancer has given me a new empathy for people with cancer, obviously. And anybody I've ever talked to that had cancer, whether it was as bad as mine or, as worse as mine, anybody that's ever heard that C word, total devastation. And then if it's not as bad, then they get through it and they go through their journey more quickly. But just hearing that you have cancer, that had to be one of the most devastating things for me. And I know for other people that I've talked to. Something ironic, the week before I was diagnosed, there was a breast cancer commercial on, this is 2007. There was a breast cancer commercial on. And I remember looking at that commercial, turning off the TV and thinking, I don't have to deal with that. 1 week later, I was diagnosed and it was like, whoa. So my whole attitude, I think God was teaching me a big lesson there, but that was one thing I wanted to tell you. The other thing is after all these years, 2007, and I told you I don't get a mammogram on this side because I had a total mastectomy and then reconstruction. But on this side, I was reduced several times. And I did want to ask you, I've been reduced like 3, 4 times trying to even me out with this surgery. I still need to get a mammogram, I guess. But what happened was after another surgery, I had a mammogram and then that surgery failed. The tissue broke. And I told my plastic surgeon, I said, I'm afraid to get a mammogram because they pull you out. I just feel like they're just ripping what little surgery I've got left there. And she said, well, let's get you a MRI. And I wanted to ask you, do I really need to get this MRI after 2007? I've been reduced. There's not that much breast tissue left. I still need it. Do you think?
Well, I would say if your doctor has a clinical concern, there's a reason why they've ordered the MRI. So I would talk to them about the reason why. If it's for screening, I don't know, Dr. Vera, what you do, but I don't advise adding MRI for breast cancer screening in women who've had breast cancer unless they were diagnosed under age 50, then you want to keep a closer eye. Or if they've got a genetic mutation that's linked to breast cancer, then I would say MRI is important for a few years. There are other special cases.
I was diagnosed under 50, and I think the reason she ordered the MRI was because the mammogram, I feel like it almost ruins that
Yeah, you
stitching.
still need the mammogram though, because
I
that's
need
still
to
the
get it.
standard for screening. And
Okay.
mammogram can find subtle changes that MRI does not.
Even though I've been
So,
reduced like 3, 4 times, I still need it.
yeah,
Okay, that was my thank you. Thank you. You
okay,
kind of I was kind of on the fence thinking, but now after talking to you, I think I'm going to get it scheduled.
good,
All right, thanks.
good, good.
Thank you.
Not to be timekeeper, but it is officially 6:30, and I think there's another group that starts for cancer support community at 6:30.
Yes,
So,
if anyone needs to jump off, they can. And if
okay.
there aren't any more questions, actually, if there are more questions, you can always email and I can make sure that it's received by the doctors and we find out the answers. And I also wanted to mention, if you're interested in any of our programs at Cancer Support Community or finding more, just reach out to me. You can just reply to that email you got today with the Zoom link. And we often see a lot of patients. I heard, I forget, I think it was you, Dr. Frost, that said, when treatment is all done, sometimes it is that's the time when you go, wait, what just happened? You do fine going through treatment, but when it's done, that can be really challenging. And we're here for you no matter where you are in the journey, not just us at Cancer Support Community, but also your doctor. So all right, lots of thank yous in the chat. Thank you all for being here. Thank you, Dr. Vera and Dr. Frost and Dr. Quarterman. You were fantastic. And
Thank you, everyone.
we wish you a good evening.
Thank you.
Have a
very
good night,
much.
folks. Thanks for joining.
Bye.
Bye-bye.